My name is Leila May, and this discussion is for leadership practices and organizational communications. The discussion today will be on avoiding hospital readmissions with improved patient education. You may be wondering why this topic is so important and what impact it has on the healthcare industry. To start, readmissions are a cost burden on Medicare, state Medicaid, and private insurance companies. Patients are also dissatisfied with the healthcare industry when they find themselves readmitted. Patient readmissions also cause pressure and increased costs of the hospital. According to the Centers for Medicare and Medicaid Services, at least 20% of all patients who are admitted to a hospital will be readmitted within 30 days of being discharged. But 75% of these readmissions could have been prevented with better care and education. The focus of this talk is how improvements in patient education can help prevent hospital readmissions. The problem is that many patients do not receive sufficient education on how to manage their care or about the disease process, how to take their medications, or whom to follow up with after discharge. As a home care nurse, I have experienced that many patients are discharged from facilities with discharge instructions, but many do not actually read the education material that is sent home, or they don't even understand it. When I sit with the patients and start talking or educating, I constantly hear, "No one has ever told me that before," or, "Oh, that makes sense now," or, "I didn't know I was supposed to do that, and why is this the first time I'm hearing it?" And sometimes this information was provided to them, but they needed to hear it again to understand. There are many barriers when educating patients, such as the education medium, patient's language, literacy levels, cultural competence, current distractions, and the patient's current environment. Another big reason that patients are not getting the proper discharge education is that many facilities are short-staffed, and nurses and clinicians are unable to find the time to properly take to assess the patient's understanding and provide the education. It's difficult for nurses to manage and create time for education with our heavy task assignment, but it is important to prevent patients from hospital readmission or decline in their health. First, the environment plays a large factor in patients' retention to discharge instructions and education. I know that when I am a patient myself, I find it difficult to pay attention to the staff in a clinical setting, especially when I'm feeling sick, stressed, and even hopeless. Many patients only hear the first few sentences, and then they start analyzing the information and get emotional or distracted by the busy environment, or they just shut down. Sometimes the information is better understood at a later time with less distractions and stress. Second, analyzing a patient's literacy, culture, and language is huge in determining how the patient will absorb the information and understand it. Many patients are provided lengthy educational handouts from the hospitals, and they tell me that they read it. I find out later through assessment or from family members that the patient can actually read, but they won't admit to it. It is crucial to determine the reading level of the patient as well, because they may not be able to understand medical jargon, but they can read. They just can't interpret the medical information that's being provided to them. I have also witnessed that majority of educational handouts are written in English or Spanish only. And in America, we have many immigrants whose primary language is not English. They may be able to speak it, but they may not be able to read it. Having education provided in a patient's primary language is important for the patient to understand. Third, the medium that the education is provided is also important. It is important to understand how the patient learns best and to tailor the education to that patient's advantage. For example, one patient may learn best from visuals or reading printed instructions. Another may prefer to watch a demonstration. According to a journal article by Deborah Polster in Nursing Management, blending elements from multiple adult learning styles increases the likelihood that patients will remember the essential information. Most people are visual learners and prefer to have a demonstration or visual aid to enhance understanding. Many elderly patients have trouble with vision and have difficulty reading educational handouts, so maybe a presentation and a layout is important to consider with the elderly population. Big, bold colors, font that's easily readable. So in conclusion, when educating your patients, please keep these educational barriers in mind. Providing proper education to patients is the most important element in preventing hospital readmissions.